5 on your health this morning, the best plan for detecting breast cancer. There's a lot of new advice out there.
Here to break it all down is Dr. Leif Ellison, the program director for breast medical oncology at the Mass General Brigham Cancer Institute. Doctor, we appreciate you joining us this morning. Let's start with those regular self-exams. Is there any evidence that they work?
Well, the fact is there's not a lot of evidence that doing a self-exam works, so folks don't have to feel bad about not doing them. On the other hand, of course, we know that it's good to have awareness of your own body. So if I might give a couple tips, it turns out that there are a lot of things that cause pain in the breast. Cancer tends not to be one of them, and so pain is common, but women don't necessarily have to be concerned that that's a cancer that's brewing. Secondly, lumps are normal in the breast. Lumps that go up and down with the monthly cycles are normal in the breast. Those things are all normal. What isn't normal usually are lumps that tend to distort the contour of the breast or the skin, causing a dimpling or a puckering. So even looking in the mirror, sometimes women can see those things. And if you have that kind of distortion of the breast, that's something you might want to seek attention to. So always good to know what's happening in your own body. And even that mirror exam of the breast can sometimes be helpful.
Yes, pay attention. But what do you tell your patients about getting the mammogram?
Well, most major medical organizations recommend having a mammogram starting at age 40 and having it every year. And most insurance plans will cover that without a copay. We know from a lot of data over decades that that's the way to save the most lives from breast cancer, getting a mammogram starting at age 40 every year.
As you know, when patients receive those results, they also learn whether they have dense breasts or not. What's your advice if they do?
Well, it's a very good question because the breast density is an area of confusion. And it turns out that there are densities in every woman's breast. And, the thing that makes a difference is how much density there is. And there's really only one pattern, something called extreme density, which is reported on the mammogram report, that is associated with higher risk. However, it is the case that women with above average density might benefit more from something called 3D mammography, which is also called tomosynthesis mammography, which is now becoming the standard in most places and is very common. So density is common. Everyone has density. It's really only the extreme density that poses the biggest challenge and is associated with increased risk.
Okay, knowledge is power. Thank you, Dr. Leif Ellison, the program director for breast medical oncology at Mass General Brigham Cancer Institute. Have a good weekend.
My pleasure. Thank you.
You're welcome.